Welcome to the training video for reprocessing Olympus OES fiber optic bronchoscopes and EVIS Xera and Xera 2 video bronchoscopes. This video program will demonstrate a generic cleaning and disinfection procedure suitable for most Olympus bronchoscopes. This video supports but is not intended to replace the reprocessing information provided in the instruction manuals that accompanied your bronchoscopes when purchased. Consult your bronchoscope's instruction manual for specific information on the particular model bronchoscope that you are reprocessing. Only trained personnel should reprocess medical endoscopes. When performed according to instructions, endoscope reprocessing is safe and effective, as this video will demonstrate. To perform the reprocessing procedure, the following Olympus reprocessing accessories will be needed: a water-resistant cap, a reusable or single-use channel cleaning brush, a reusable or single-use channel opening cleaning brush, a leakage tester, a suction cleaning adapter, a 30 cc syringe for injecting reprocessing fluids through the endoscope, a source of suction to aspirate fluids through the bronchoscope, and either an Olympus light source or maintenance unit to provide a source of air for leakage testing. Consult your bronchoscope's instruction manual for a list of required general supplies. Before we start, a few words about personal protective equipment. Reprocessing chemicals are toxic, and patient debris represents an infection risk to reprocessing personnel. Always wear appropriate personal protective equipment and comply with local hospital guidelines as well as applicable state and federal regulations. Appropriate protective equipment may include a moisture-resistant gown, chemical-resistant gloves of proper fit and adequate length to prevent skin exposure, and protective eyewear or a face mask. Be sure to remove soiled personal protective equipment before leaving the reprocessing area. Before we look at the individual steps involved in bronchoscope reprocessing, here is a general overview of the procedure. There are 4 major steps to reprocessing a bronchoscope. The first step is pre-cleaning, which is performed at the bedside immediately after the patient procedure. Pre-cleaning removes gross debris and prevents patient material from drying onto the endoscope. The second step is leakage testing. Leakage testing ensures that the bronchoscope is air and fluid tight. A leaking endoscope will be severely damaged if fluids enter the instrument. Leaking endoscopes also present an infection control risk. The third step is manual cleaning. This involves thoroughly cleaning the exterior surface, all internal lumens of the endoscope, and all removable parts by wiping, flushing, brushing, and rinsing all surfaces. The final step is high-level disinfection or sterilization. High-level disinfection is performed by immersing the bronchoscope in an FDA-cleared high-level disinfectant and ensuring that all surfaces are contacted for the specified time and at the temperature recommended by the disinfectant manufacturer. As an alternative to chemical disinfection, the bronchoscope may be sterilized using an approved method indicated in the reprocessing manual. Pre-cleaning is the first reprocessing step and is performed at the bedside immediately after the patient procedure. Pre-cleaning is critical to remove gross patient debris from the bronchoscope before it has a chance to dry. For pre-cleaning, you will need a 500 milliliter container of detergent solution nearby. First, turn off the video processor and light source. Then, gently wipe the bronchoscope insertion tube from the control section to the distal tip, using a lint-free cloth or sponge soaked in detergent solution. Next, turn on the suction pump or connect the bronchoscope to wall suction. Make sure that the biopsy valve is still attached. Immerse the distal end of the bronchoscope in detergent solution and aspirate for 30 seconds. Remove the distal tip from the detergent and aspirate air for 10 seconds. Now turn off the suction pump. Disconnect the suction tube and remove both the suction valve and the biopsy valve. Both of these items are intended for single use and should be discarded. Disconnect the videoscope cable and disconnect the bronchoscope from the light source. Finally, transport the bronchoscope to the reprocessing room in a closed container. The following steps should be performed prior to immersing your bronchoscope in any fluid. Visually inspect the water-resistant cap for damage. If it is damaged or wet, use another cap. Attach the water-resistant cap to the bronchoscope. Remember, never connect or disconnect the water-resistant cap while the cap or the bronchoscope is immersed. Doing so will damage the bronchoscope. Now we are ready to proceed with leakage testing. Attach the leakage tester to the MU1 maintenance unit or to an Olympus light source. Turn on the air supply. If you are using a light source, be sure to set the airflow rate to its maximum setting. Depress the pin inside the connector and confirm that air comes out of the cap. Now, attach the leakage tester to the bronchoscope. As you pressurize the inside of the bronchoscope, the rubber sheath on the distal tip of the bronchoscope will expand. Note that if you are reprocessing a fiber optic bronchoscope rather than a video bronchoscope, the leakage tester is connected directly to the endoscope. Fiber scopes do not require a water-resistant cap. Now immerse the bronchoscope in clean water. Do not leak test in detergent, as detergent will hinder visualization of leaks. Angulate the bronchoscope tip in both directions. Deflecting the tip will help expose any pinholes that may exist in the bending section rubber. Initially, you may see a few bubbles clinging to the insertion tube or coming out of a channel opening. These do not indicate a leak. Wipe away any bubbles clinging to the instrument. If you see no source of continuous bubbles emanating from the bronchoscope is air and fluid tight. In contrast, if you do observe a continuous stream of bubbles, the bronchoscope is leaking. Leaks like this will allow fluids to penetrate and damage the bronchoscope. If you observe such a leak, do not turn the air supply off. Rather, remove the bronchoscope from the water, blow out the channel with air, and dry the bronchoscope prior to turning off the leakage tester. Contact Olympus for instructions on how to reprocess a leaking bronchoscope prior to sending the bronchoscope to Olympus for repair. Instructions for returning a leaking endoscope can be found on Olympus America's website. If no leaks are observed, remove the bronchoscope from the water. Turn off the pump, disconnect the leakage tester from the air supply, and wait for the bending section rubber to return to its normal size. Detach the leakage tester from the water-resistant cap. Leakage testing is now complete. The next step is to manually clean the bronchoscope. Effective cleaning will remove more than 99% of the bioburden from the bronchoscope. Failure to adequately clean the bronchoscope will reduce the efficacy of the high-level disinfection or sterilization procedure that follows and poses an infection control risk. Prepare a basin of detergent. Always use freshly prepared detergent at the specified concentration. Never reuse detergent solution. Carefully coil the bronchoscope and completely immerse it in the detergent solution. Use a soft brush or a lint-free cloth to clean the exterior surface of the bronchoscope. Pay particular attention to cleaning the distal tip. Take care not to scratch the small lenses. Perform all washing while submerged to prevent splashing. Next, brush the channels. Start by inspecting the channel cleaning brush for any damage. To clean the suction channel, insert the brush into the suction valve cylinder. Use short strokes to advance the brush through the insertion tube until it emerges from the distal tip. Remove any debris from the bristles with your fingers and gently pull the brush back through the channel. Inspect and clean the bristles again. Repeat this process until you cannot see any further debris on the bristles. Note that some model bronchoscopes, such as the BF3C160 and the BFXP160F, require two different cleaning brushes for this step. Check the instruction manual of the bronchoscope that you are reprocessing for specific instructions. Next, insert the channel brush into the instrument suction port. Pass the brush through the insertion tube until it emerges from the distal tip. Clean the bristles. And retrieve the brush. Once again, clean the bristles. And repeat until no debris is observed on the brush tip. The next step is to clean the channel openings. Carefully insert about 1/2 of the channel opening brush into the suction valve housing. Rotate the brush and remove. Clean the bristles. Repeat this procedure until no visible debris remains. Now move down to the instrument channel port. Insert the brush. Rotate and remove. Clean the bristles. And repeat until no visible debris remains. Now that the channels have been brushed, the next step is to flush the channels with detergent solution to remove any remaining debris. Attach the suction cleaning adapter to the bronchoscope. Attach the adapter to a source of suction. Immerse the distal tip of the bronchoscope in detergent solution and aspirate the detergent for 30 seconds. Now that the channels have been flushed, it is necessary to fill the channels with detergent and allow them to soak. Disconnect the suction tube and connect a clean 30 cc syringe to the suction cleaning adapter. With the bronchoscope immersed in detergent, withdraw the plunger to fill the channels of the bronchoscope with detergent solution. Disconnect the suction cleaning adapter from the bronchoscope. Allow the bronchoscope and cleaning accessories to soak in the detergent solution for the time recommended by the detergent manufacturer. The next step is to rinse the detergent from the bronchoscope. It is critical to remove all traces of detergent as it may interact with or inhibit the activity of the high-level disinfectant or sterilant you will use later. Transfer the bronchoscope and accessories to a basin or sink filled with clean water. Disposable cleaning brushes will be later discarded. Use a clean, lint-free cloth to wipe the outside of the endoscope. Reconnect the suction cleaning adapter. And connect it to a source of suction. Aspirate rinse water through the channels for 30 seconds. Remove the bronchoscope tip from the rinse water and aspirate air for 20 seconds. Completely remove the bronchoscope and cleaning adapter from the rinse water and place it on a clean, dry cloth. Use a dry, lint-free cloth to dry all external surfaces of both the bronchoscope and the suction cleaning adapter. Visually inspect the bronchoscope and cleaning accessories. If any debris remains, you must repeat the manual cleaning process. The bronchoscope must be completely clean before proceeding with disinfection. The next step in reprocessing the bronchoscope is either high-level disinfection or sterilization. All Olympus bronchoscopes can undergo chemical disinfection or ETO sterilization. In addition, certain Model X-Era 2 bronchoscopes may be steam sterilized after placing them in an appropriate protective tray. Note that autoclavable bronchoscopes have a green water-resistant cap and a gold band. If you are using an automated endoscope reprocessor or AER to high-level disinfect the bronchoscope, please refer to the AER's instruction manual. If you will be using an AER, you may want to skip directly to the next chapter. However, if you are performing manual disinfection, here are the steps for manual high-level disinfection. Make sure that the suction cleaning adapter is attached to the bronchoscope. Immerse the bronchoscope and cleaning adapter in a compatible high-level disinfectant solution. The solution must be tested for efficacy and prepared according to the manufacturer's recommendations regarding dilution, temperature, and contact time. Attach a syringe to the cleaning adapter and withdraw the plunger to bring disinfectant into the channels of the bronchoscope. Check to make sure that both tubes of the suction cleaning adapter are filled with disinfectant solution. Disconnect the syringe and the suction cleaning adapter from the bronchoscope. Place the adapter in disinfectant and make sure that all of the equipment is completely submerged in disinfectant. Cover the disinfectant basin with a tight-fitting lid in order to contain the disinfectant vapors. Disinfect the bronchoscope and cleaning adapter by soaking them in accordance with the disinfectant manufacturer's instructions. Use a timer to confirm that you are achieving the proper contact time. After soaking for the recommended period of time, reconnect the suction cleaning adapter. Connect a sterile 30 cc syringe to the adapter and inject air to remove all disinfectant solution from the channels. The next step is rinsing. It is very important to remove all disinfectant solution from the bronchoscope. Residual disinfectant is toxic and can injure the next patient examined with the equipment. Start by transferring the bronchoscope and accessories to a basin filled with fresh rinse water. If sterile water is not available, Non-sterile water or water that has been filtered to improve its microbiological quality may be used instead. However, always consult with the infection control representative within your facility regarding the hospital's policy on water quality. With the instrument submerged, use a fresh, sterile, lint-free cloth to thoroughly wipe and rinse all external surfaces. Connect the suction cleaning adapter to a source of suction. Aspirate water through the bronchoscope channels for 30 seconds. Remove the bronchoscope and attachments from the rinse water and place them on a sterile towel. Use a sterile, lint-free cloth to thoroughly dry all external surfaces of the bronchoscope and the suction cleaning adapter. The final step in the process is an alcohol flush. Alcohol promotes drying of the endoscope channels and inhibits growth of the waterborne microorganisms. Start by preparing a beaker of 70% ethyl or isopropyl alcohol. Connect the suction cleaning adapter to a source of suction. Immerse the distal end of the bronchoscope in alcohol and aspirate alcohol for 5 seconds. Remove the distal tip from the alcohol and aspirate air for 20 seconds. Now that the channels have been flushed, disconnect the suction tube and the suction cleaning adapter. Use a sterile, lint-free cloth moistened with 70% alcohol to remove any remaining water drops from the external surfaces of the bronchoscope and accessories. Finally, use a sterile cotton swab to dry the inside surface of the suction valve housing and the instrument port. Your bronchoscope is now reprocessed and ready for use in examining another patient, or for storage and use at a later time. If you plan to store the bronchoscope, ensure that the channel of the bronchoscope is completely dry. A wet channel promotes the growth of microorganisms and presents an infection control risk. Remove the water-resistant cap from the light guide connector and make sure that all valves have been removed from the bronchoscope. Also check that the bronchoscope's angulation lock is in its free position. Now, hang the bronchoscope in a storage cabinet. The distal tip should hang freely, with the insertion tube as straight as possible. A word of caution: do not use the bronchoscope's carrying case to store patient-ready equipment. Any bronchoscope placed in the carrying case must be reprocessed prior to use with another patient. Autoclavable bronchoscopes that have been steam sterilized should remain in their wrapped sterile tray until further use. Now that the bronchoscope has been reprocessed and stored, a few words regarding the reprocessing of ancillary equipment. Note that the water-resistant cap and the suction cleaning adapter have been reprocessed along with the bronchoscope. In addition, all single-use disposable items should have been discarded. This includes the suction valve, biopsy valve, and any single-use cleaning brushes. This leaves mouthpieces and reusable reprocessing items such as reusable cleaning brushes to be reprocessed. These items should be thoroughly cleaned in detergent solution and then rinsed and dried. Since these articles are autoclavable, it is recommended that they be appropriately wrapped and subjected to steam sterilization. Refer to the instruction manuals detailing these items for further information. You have now reviewed the steps required to safely reprocess your Olympus bronchoscopes. To summarize, there are 4 major parts to bronchoscope reprocessing. Number 1, it is mandatory to pre-clean the instrument at the bedside to remove patient debris immediately following the procedure. Pre-cleaning prevents patient material from drying onto the bronchoscope. 2. Leakage testing is required to ensure that the channels and insertion tube are not damaged and that all seals are air and watertight. Routine leakage testing prevents costly fluid invasion and therefore costly instrument repairs. Never use a bronchoscope that has a known leak on a patient, as this can be an infection control risk. 3. A critical step is meticulous manual cleaning with a detergent or enzymatic solution. Use appropriate brushes and cloths to thoroughly clean all exterior surfaces and internal lumens. High-level disinfection or sterilization is the next step. High-level disinfection kills or inactivates any remaining vegetative bacteria, viruses, and fungi. The disinfectant should be tested regularly for its minimum effective concentration and used at the temperature and for the contact time recommended by the manufacturer. Also remember, disinfectant solutions are toxic. Wear appropriate personal protective equipment throughout the entire procedure. And thoroughly rinse all disinfectant from the endoscope prior to the final alcohol flush drying procedure. This training video presents a general procedure for bronchoscope reprocessing. Consult the instruction manuals that came with your bronchoscope for specific details on how each particular bronchoscope should be reprocessed. Certain model bronchoscopes may have features that require additional specific steps. The instruction manual will also contain important information on how to properly handle your bronchoscope, how to inspect it for damage, and how to troubleshoot problems. If you wish to review any chapter of this training DVD, you can jump from chapter to chapter using the controls on your DVD player. Olympus also offers on-site and off-site training, wall charts, and other reprocessing materials and aids. Refer to the Olympus America website at www.olympusamerica.com for additional information. Thank you for viewing this video on bronchoscope reprocessing. Olympus, your vision, our future.